Hello, this is the third portion of our little mini series on CBT and using it specifically for anxiety. And today's example we're going to use is anxiety connected to Spravato and TMS because we do get a lot of people that have anxiety about both procedures. They're very similar concerns. So we're going to talk about that, and we're going to talk about just in general, how we're using CBT. If you've missed the first two videos, I encourage you to go back to them, and so you'll understand why we're using A, B, C, antecedent, belief, and consequence specifically for this. It's a little different than typical mood logs, but my hope is that this will be helpful for you. So Spravato and TMS, what are they? Spravato is an FDA-approved medicine that we use. It's Esketamine. It is used in the treatment for treatment-resistant depression. TMS, also FDA-approved in the treatment of treatment-resistant depression, but also for OCD and smoking cessation. There are some other differences, but for today, we're using both of them because we see people with anxiety connected to both of these things. The first question is it safe, right? I'm getting ready to put a magnet beside my head. I'm getting ready to take a substance, an intranasal substance that I might have heard some weird things about it. Both safe, both FDA approved, and I will tell you that the fear may be similar to my diving example that I gave, where it's like, well, I know rationally, I know all the data and such, so I shouldn't have this fear, but that doesn't mean that there isn't still a fear there. So we're going to focus on that. The fear that it may be unsafe, the fear that there may be addiction, or a fear that I'm not going to improve, I'm not really going to get better anyway. I've been on all these different medicines, I've tried all these different things, nothing's going to work anyway. I'm not sure why I'm wasting my time, why I'm wasting their time. I had a person say this, that doctor thinks she knows what she's talking about. And she really does believe this is going to work for me. But I already know in my heart of hearts, it's not going to work because nothing else has worked. So why would this? Okay. I'm not going to enjoy this experience. I've heard that TMS is painful. I've heard that Spravato tastes terrible. And then I'm going to be disappointed because I've heard some people have had a positive experience, but it's not going to be positive for me. That's the depression talking. That's anxiety talking. So how do you deal with that when you're struggling? Very similar to my dive example. You meet it head on, and I write out, okay, what are the things that I'm nervous about, I'm afraid of? It's unsafe, right? There's addiction possibility. I'm not going to improve. I'm not going to enjoy this experience. I'm not going to be able to tolerate this experience. The first thing I would say to anyone dealing with any of these concerns, especially, or any concern, first of all, recognize what it's leading to. In this case, most of these are fears that are producing some anxiety, maybe some disappointment. And then for a lot of people, it worsens the depression or worsens the anxiety. I'm never going to get better, right? I'm always going to be in this state. That can breed both of those emotions. Then I think education, grounding, and visualization can be helpful, just like they were helpful for my diving example. The information or education, learn what you can about this, but don't overdo it. Again, I didn't say this specifically in the diving example, but I learned what I need to know and then I practice. Right? And I learn what works for me, what I need to know for me. I'm not going to go and look up every bad instance that I've ever seen about things, because there's always an example where things can go wrong. Why would I want to go and fester on those things, right? Because that's what it is. It's focusing and festering on those things. I'm going to learn information from reputable sources about it. I went to Mayo, I love Mayo. I went to Hopkins, love Hopkins. I like their information. I think it's value information. I think it's good information. And it is research-based. Talk with your provider, right? A provider that you trust. Talk with them about what's going on and what they know about this. And if they say, I really don't know anything about it, then ask them for someone that they know that might know about it. For REMS, for Spravato, go to a REMS treatment center. It's a center that has been FDA certified, basically, because they've earmarked that center. That center has been trained to be able to use the medicines and document that they're used appropriately. Like Lead Life is a REMS center. So if that provider doesn't know the information, go to a REMS center that does have good quality information that they're producing. Hopkins has a REMS center. I believe that Mayo also. Mayo does, actually. They do. I learned that when I went to the Psychiatry conference this year. So they do as well. So those are great places because they put out good quality evidence and they're good information as well. We put out a fair amount of evidence as well. So you can always look at any of our videos. And if we don't know something, we will let you know. We're going to go find the information out and then we're going to come back and share it with you. TMS, same thing. Find a good center that's doing a lot of TMS. Find a center that's putting out information that's good quality information and go there. If you see testimonials from patients, read the testimonials. That's good stuff. Video testimonials, look at that information. That can be very helpful for you. Then grounding and visualization, I think, are very helpful. Being able to visualize what could be. One of the things that we do with all of our patients is a period of goal setting. And when we're goal setting, we're asking them, what is your goal? What do you want to see things look like? Where do you want things to go? What do you want things to be? And that can be very helpful. That can be incredibly helpful to see what it could look like. Once you've done that, that will really help you out. And then grounding. Before, during, and after your procedure, we use grounding exercises. The 5, 4, 3, 2, 1, 5 things that you see, 4 things that you can feel, 3 things that you hear, 2 things that you smell or taste, 1 thing that you smell or taste. Depends on where you are and what you're doing. Those things can be incredibly helpful. So don't give up on a potentially life-saving experience or procedure because of fear, right? 9 times out of 10, the thing that you're afraid of is not going to happen. And then you would have missed out on a very rich and beautiful experience. Okay, I'm Dr. Bergina, and I hope you have a very blessed day on purpose. Take care.